Hey future nurses, welcome back to Scrub and Spoon. How are you all doing? If you are new here, welcome. I am Nurse Funke, okay? And I'm glad to have you joining today. Now, today's Nclex review is on cystic fibrosis. Listen to this. One of my nursing students that I coach told me he saw diagnostic test for CF, cystic fibrosis, on his Nclex exam. So I needed to watch this till the end. I needed to learn throughout this review. And I also made another video that I talked about cystic fibrosis, the diagnostic test, the signs and symptoms, treatment, detailed video. So go review that. Know your content first before going through the questions, okay? That will help you. So don't let us waste too much of our time. Don't forget to check out my website for the master method study guide, okay? Now, without wasting our time, let's go right into it. Now, first question says, which body system is most commonly affected in cystic fibrosis? A, musculoskeletal system, B, endocrine system, C, respiratory system, and D, urinary system. Please pick your answer. If I'm going too fast, pause, pick your answer and listen to the rationale, okay? Now, guys, the right answer is C, respiratory system. Let's break it down. Now, what is cystic fibrosis itself? Cystic fibrosis is a genetic disorder that affects the exocrine glands, and this will cause the thick sticky mucus to build up, clog, and impair lung function and digestive system function. It also affects other organs like pancreas, the liver, and even the reproductive system, okay? And exocrine glands are responsible. They help to produce and move secretions through the organ ducts. Now, in CF patients, listen to this. Instead of the exocrine gland that produce watery fluids, now in CF patients, exocrine glands produce thick, sticky mucus, thick, sticky secretions, and these secretions are hard to push through the organ ducts. Okay, are you understand? Because I need you to understand it. Okay, so just at the front or back of your head, when you hear cystic fibrosis, no, we are talking about thick, sticky mucus affecting the lungs, affecting the intestine, the digestive system, affecting the pancreas. It can affect the liver, even the reproductive system, because males, that is men with CF, they often have infertility issue. We will get through why in the review, okay? So now I've broken down what is CF for you guys. The question says, which organ is mostly affected? Say which body system is most commonly affected? It's respiratory system, because the thick sticky mucus clog and builds up in the lungs. And what happens in the lungs? Air exchange, respiration, air exchange, CO2 out, oxygen in, O2 in. So this thick sticky mucus builds up in the lungs and impair the airway, impair gas exchange. So respiratory system is the primary organ that is affected in CF, okay? And when there is thick sticky mucus in the lungs, this can cause bacteria to, we'll go further in the review, you understand what I'm saying. This can cause bacteria to invade the lungs, and that will lead to infection. And that's when you will see signs and symptoms like coughing, wheezing, reoccurrent or repeated lung infection, okay? And I need you to know that lung infection and respiratory failure is the leading cause of death in CF patients. So don't play with CF patients. Don't play with airway, because when those sticky mucus or secretions block the airway, you know, when the airway is clogged or blocked, the patient is dead. So that makes our right answer C, respiratory system. Let's go through the wrong choices. Now, A says musculoskeletal system. Now, CF patients may have muscle wasting or clubbing of the fingers and toes due to malnutrition. But this system, musculoskeletal system, is not the primary system affected in CF. Okay? And you will see clubbing. Another signs and symptoms, you will see clubbing in CF patients because of chronic hypoxia. Hypoxia is when there is lack of oxygen supply to the tissues, okay? So you see clubbing. Clubbing is when the fingers or toes, they are large, round, and curled downward. You will see that in CF patients because of hypoxia. Okay, so but this A is wrong. Now B, endocrine system. Endocrine system is also wrong, because even though the pancreas can be damaged, and this will lead to CF related diabetes. Remember, in diabetes, the pancreas, the alpha, the beta cell in pancreas is what is not secreting insulin. So when the pancreas is damaged, in CF patients, it may lead to CF-related diabetes, but it's not the primary system affected in CF. So endocrine system can fall under, like the secondary system, CF affects, but not the main system. The respiratory system is the first. Lungs, gas exchange, that's the first, okay? D, urinary system. CF does not directly affect the kidneys or the urinary tracts. So urinary system is not involved in the disease process. So urinary system is wrong. Now, some medications that is used to treat CF, like tobramycin, which is a aminoglycoside antibiotics, may affect the kidney. This medication is nephrotoxic, that is, they are toxic to the kidney, right? But CF itself does not directly affect the kidney. Okay, so I hope that's a good explanation. Let's move on. Next one, select all findings commonly associated with cystic fibrosis. This is select all that apply. A, meconium ileus in a neonate. B, polyuria with hyperglycemia as the first sign in infancy. C, digital clubbing in advanced lung disease. And D, male infertility due to congenital bilateral absence of the vas difference. Okay, so pick your answer. Guys, this is select all that apply. We'll go through it together as true or false. But before we go, what they're asking us for common findings. When you see these signs and symptoms, when you see these presentations, you will know that, okay, this is common, this is cystic fibrosis. So let's go through it together. And it says meconium ileus in neonates. This is often the earliest signs of CF in newborns. Let's break it down. What is meconium? This is the first stool a baby must pass within the first 24 hours of life. And now ileus is like obstruction of the ileum, or when there is lack of movement of food or stool in the small intestine due to blockage or lack of peristalsis. And also because in CF patients, remember this thick sticky mucus. When you hear CF, remember thick sticky mucus, thick sticky secretions. The meconium is now thick and sticky, and it is very hard to pass out in the neonates, like newborn. So this definitely will be a sign of CF in newborn, in neonates. Okay, the thick sticky secretions or mucus blocks the ileum, and the meconium itself is also thick and sticky, hard to pass out. Okay, and that's why you will see abdominal distension, vomiting, and failure to pass that meconium. Okay, this is very classic sign of CF in neonates. So that is true. Now B, polyuria with hyperglycemia as the first sign in infancy. Hold it. Let's break it down. Polyuria and hyperglycemia. What is that suggesting to you, my dear students? Diabetes. Polyuria, excessive urination, frequent urination. Hyperglycemia, high blood sugar. Diabetes. Okay, even though CF related diabetes can happen or appear in adolescence or adulthood, but not in infancy. Remember, CF will also affect the pancreas. I've talked about that. CF can affect the pancreas. This can lead to CF related diabetes, but it will not be indicative of CF in infancy. This can happen later, much in life, when they are adults. Okay, so this is wrong. So polyuria with hyperglycemia are not early common first sign in CF. Now let's move on. So that's B. C, digital clubbing in advanced lung disease. I've explained this before, because due to chronic hypoxia, lack of oxygen supply to the tissue. Why? Because in CF patients, they often get lung infection, and this can over time progress to slowly progressing to lung damage. When the body realizes that there is low oxygen for a long time, over time, because of the lung disease, lung infection, it will impair gas exchange, it will impair oxygen distribution to the tissue. The body starts sending extra blood to part of the body it feels needs it more, and it will send more to the including the fingertips and toes. And that's why you see digital clubbing is when you see the round, large fingers or toes, and the fingers or toes will curl downwards. So that is true. That is very true. And this is very common in advanced CF. Now, that's true. Now, D, male infertility due to congenital bilateral absence of the vas difference. Now, statistic has shown that up to 98% of male CF patients may or are infertile. And why? Because thick, sticky mucus prevent the vast difference from developing. Okay, now sperm production is normal in male CF patients, but the sperm cannot be transported. That is the vast difference that transports the sperm. Okay, there is no vast difference to carry or transport the sperm to the semen. So the sperm stay trapped inside the reproductive tract. So when these men ejaculate, there is no sperm in their ejaculation. And without sperm, how is a male supposed to impregnate? Okay, so that is how infertility occurs in male CF patients, even though their hormone and sperm production are normal. So A, C, and D are common findings associated with CF, cystic fibrosis. Okay, so let's move on. Now, which nursing action best reduces risk of atelectasis and improves secretion clearance in CF patients? A, encourage daily use of short-acting bronchodilator only, then rest. B, teach and assist with airway clearance techniques, vest, percussion, active cycle breathing. Now, C, limit fluid intake to decrease production of sputum. And D, routinely prescribe systemic antitussive to suppress cough. Now, pick your answer. Guys, the right answer is B, teach and assist with airway clearance techniques, vest, percussion, active cycle breathing. What the question is asking us is that what are the best actions to reduce risk of lung collapse, atelectasis, and improve secretion clearance? How to remove the sticky mucus and secretion in CF patients? And the right answer is to teach them. Now, chest physiotherapy is done in CF patients through the use of percussion, vibration, postural drainage, and active breathing exercise to help them to loosen and clear the mucus or the respiratory secretions. This will help and prevent airway blockage. This will also help and improve gas exchange. This will also help to prevent pneumonia and atelectasis, collapse of the lungs. So that is why B is right. Okay, so chest physiotherapy and cycle of active breathing techniques. These are all airway clearance techniques that would help mobilize and clear the respiratory secretion from the airway so they can breathe properly. Now let's go through the wrong choices. A, encourage daily use of short-acting bronchodilator only and rest. Guys, Nclex will trick you. Listen to this. Make sure when you are selecting your right answer, all the statements is correct. Now see, encourage daily use of short-acting bronchodilator like albuterol, fine. But only, no, that's not the only treatment in CF. That only makes it wrong. Only, always wrong. Be careful of those kind of choices. Wrong and rest. So that is wrong. Okay, even though inhaled bronchodilators help to open the airway, but bronchodilators on its own, go review the detailed video I made on CF, teaching everything about it before coming to do this review. But bronchodilators on their own do not help to move or mobilize the secretion out of the airway. They can help to open the airway. And like I said, bronchodilator is used before chest physiotherapy. Because students always get this confused. This question is always confusing students. On Nclex, on your nursing school exam, which come first? Bronchodilators come first before chest physiotherapy. So think about BP, bronchodilator before physiotherapy. Okay? So yes, they use CF patients use bronchodilator, but it does not help them to actually loosen or move these secretions or the mucus out of the airway, but it helps to open the airway. And also, resting after using bronchodilator without clearance of the airway defeats the purpose. Okay, so this is wrong. And C, limit fluid intake to decrease sputum production. If you've seen that video, I told you that fluids is encouraged in CF patients because fluids help to thin the mucus, thin the secretion, so it's easily expelled or coughed out. So this is wrong. C is wrong, okay? And D, let's go to D. D, routinely prescribe systemic antitussive to suppress cough. We want them to cough. We want the airway to be open and then to cough the thick, sticky mucus that is blocking the airway to expel it out. So if you give them antitussive that suppress coughing, how is the thick, sticky mucus going to come out? They need to cough it out. So actually giving them that is not working for them. It's working against them. Because if you suppress that cough, that will worsen mucus retention in the airway, in the lungs. That would also lead, or can also lead to atelectasis, that is collapse of the lungs, and the patient risk infection, because if the thick sticky mucus is being built up, it will clog the lungs, it will clog the airway, and there are some bacteria that enjoy staying in a thick sticky environment. Bacterial infection will occur. So that is actually wrong. We want them to cough this, to clear the airway, to cough the thick sticky mucus out. Okay. Now let's move on. Which are appropriate monitoring tests for a person starting long-term inhaled tobramycin? Select all that apply. A, periodic renal function test, serum creatinine. B, baseline audiology, hearing assessment. C, daily complete blood count, CBC indefinitely. Now, D, sputum culture to monitor microbiology and resistance. Now, this is select all that apply. We will do it together, but let's understand what they're asking us. Okay, so you're asking that a patient wants to start tobramycin therapy, right? And which are the appropriate monitoring tests to do before this patient or while this patient is on this tobramycin therapy? It may interest you to know that tobramycin is aminoglycoside antibiotics. And if there's anything you should know about this type of antibiotics, they are nephrotoxic and ototoxic. That is toxic to the kidney and toxic to the air. So let's go through it together. So A says periodic renal function test, serum creatinine. One thing we know about creatinine is normal creatinine is 1.2. If the creatinine is above 1.3, it shows the kidney is bad, right? And remember, the medication they're about to start, the tobramycin therapy they're about to start, I just mentioned that it is nephrotoxic. It is toxic to the kidney. So performing renal function test will help you to know how well the kidney is functioning before initiating this therapy for them, because this medication can affect the kidney. Okay, so this is actually right. Okay, especially the fact that it says the medication therapy is going to be for a long time. Let me see. You say starting monitoring test for person starting long-term inhaled tobramycin. So it's going to be long-term. So you want to know how well the kidney can take it, how well the kidney function is before starting this antibiotic therapy. So this is right. A is correct. Now let's move on. B, baseline audiology bracket hearing assessment. I just said it that these antibiotics they're about to start, tobramycin, is aminoglycoside. Aminoglycoside like this tobramycin, gentamicin, are ototoxic. They are toxic to the ear. Especially that this tobramycin therapy is going to be for a long time. If hearing assessment is not done during the period of them taking this medication, the medication can cause hearing loss, tinnitus, that is ringing in the ears, okay, vertigo, balance problem. So that is why they need to know how well they can hear before starting this medication. It's very important and essential for the patient to get baseline hearing test before starting tobramycin therapy. So that is true. Now, C, daily complete blood count, CBC, indefinitely. A daily CBC is not necessary, especially it says indefinitely in when a patient is about to start tobramycin therapy. It is really not necessary. So daily complete blood count is not common concern in inhaled tobramycin therapy. Okay, so that is wrong. And D, now sputum cultures to monitor microbiology and resistance. This is true. CF patients often have chronic lung infections, and this is because the thick sticky mucus can clog the lungs, and when there is thick sticky mucus in the lungs, there is a particular bacteria that loves sticky environment. That bacteria will grow in that environment and cause infection for patients with CF, and that particular bacteria, I'm going to display the name of that bacteria. It's called Pseudomonas aeruginosa. I'll display that on the screen, right? So it loves sticky environments, and it will always cause lung infection in patients. There are other variants or of bacteria that can cause lung infection in CF patients, but especially most commonly this type of bacteria. It loves sticky environments. So inhaled tobramycin is often used to suppress the bacterial growth. So if they do sputum culture, it will help to track the bacteria resistance trends. It will also guide them on antibiotic rotation. The sputum culture will also help them to assess treatment effectiveness, because when they do the sputum culture, they will be able to see how much of bacteria is in the sputum or in the secretion. Okay, so this is also right. Our right answers are A, B, D. Okay, let's move on. A nurse is providing teaching to the parents of a child recently diagnosed with CF, cystic fibrosis. Which statement by the parent indicates a correct understanding of the treatment plan? A. Will give the pancreatic enzymes with every meal and snack to help digestion. B. It's best to limit salt in their diet because of mucus buildup. C. Will avoid all physical activities to reduce breathing difficulty. And D. Antibiotics are only needed for severe infections, not for daily maintenance. Okay, pick your answer, guys. Guys, it's very obvious. The right answer is will give the pancreatic enzymes with every meal and snack to help with digestion. And why? Because CF causes pancreatic insufficiency. The thick sticky mucus blocks the duct that releases the enzymes, the amylase, the protease, the lipase enzymes that help to digest fat, protein, calories in the right, blocks that. So there is lack of these enzymes, and that is why in CF patients, despite the child is eating well, they may not gain weight because of malabsorption. The nutrients in the food is not being absorbed. The food are not digested, and that's why one of the treatments of CF is pancreatic enzyme replacement therapy. The pancreatic enzymes is either taken as whole or sprinkled on the patient's food or snacks. Okay, this will help to digest the food. This will help to replace the missing enzymes that will help to digest the food and absorb the nutrients. So the patient don't get malnourished, because malnutrition is one of concern, and failure to thrive or gain weight is one of the concern in CF. So the parents stating will give these pancreatic enzymes with every meal and snack to help with digestion, they understood the assignment. Okay, they understood the assignment. So that is right. Also, I need to say this. Also, fat soluble vitamins can be combined with the pancreatic enzymes. Fat soluble vitamins like vitamin A, vitamin D, vitamin E, and K. I hope I'm right. They are combined for optimal nutrition in patients with CF. So this supplement is another treatment in patients with CF. So that is right. They got that right. Now, B, it's best to limit salt in their diet because of mucus buildup. This is wrong concept. You know why? Because in CF, patients lose salt through sweating, especially in babies or infants. When the parents, play with the baby and kiss their cheeks, the skin tastes salty. They are losing a lot of salt through sweat. So they're already losing salt and you want to limit their salt. No, extra dietary salt, especially in hot weather, is encouraged in CF patients, or if they are exercising, because when you are exercising, you are sweating. So long they start sweating, the CF patients will lose salt through sweating. So we want to encourage, you do not want to limit their salt. You want to encourage extra dietary salt in their food. Okay, so that is wrong. Now, C, we'll avoid all physical activities to reduce breathing difficulty. Actually, regular physical activities help the patient to breathe well, help to clear the airway, help to improve lung function. Okay, the exercise helps to loosen the mucus and also reduce risk of infection. So exercise is actually encouraged. Exercise is encouraged, not limited. Look, not avoiding all physical activities at all. When you avoid all physical activity and they're not moving, the secretion is building up, it's just sitting there. But when they move, they do tolerable exercise, it helps them to move the secretion, loosening the secretion out, and they're able to cough it out. So this is wrong. And D, antibiotics are only needed for severe infection. This is wrong, because actually CF patients, they often take antibiotic prophylactically. I mean, sometimes they take antibiotics before signs and symptoms of infection, because infection occurs often in CF patients because of the thick sticky mucus that will build up in the lungs, and bacteria that love that sticky environment will enjoy that environment and cause infection. Okay, so antibiotic prophylaxis is to control bacterial colonization of the lungs. Okay, so long-term, the tobramycin is used prophylactically even when there are no signs and symptoms of infection. Okay, so that is wrong. So our only right answer is A. They understood this assignment. Let's move on. Which medications may be used to help improve airway clearance or reduce airway obstruction in CF? Select all that apply. A. Albuterol salbutamol inhalation. B. Donors alpha inhalation. C. Oral codeine for cough suppression daily. D. Hypertonic saline nebulization. Guys, they are only asking us that which medications help to improve airway clearance in CF patients, okay, and to reduce airway obstruction. So let's go through it together. A, albuterol, which is salbutamol. Inhaled bronchodilator. This is bronchodilator, and I've told you that this helps to open the airway and improve gas exchange, improves breathing, right? This helps to remove the signs and symptoms, prevents dyspnea, difficulty breathing. So this is actually true. Okay, this is correct. So A is correct. Now B, DIOS alpha. This is true. This is mucolytics. What do? They break or thin the mucus or the respiratory secretion, and that makes it easy for those mucus or secretions to be expelled or coughed out. So they thin the secretion. So this is actually true. Okay, this helps to improve lung function and decrease respiratory infection. So mucolytics like DIOS alpha is used in CF patients. Now, C, oral codeine for cough suppression daily. Never recommended in CF. I've told you guys we want them to cough. We want them to cough out, to mobilize the secretion, to expel the mucus. So we are not suppressing their cough. Okay, when those mucus and those respiratory secretions don't get out, it can trap bacteria and increase infection risk. That's not what we want. We want them to cough out. So C is wrong. And D, hypertonic saline nebulization. This is osmotic agent. This draws water into the airways and hydrates and loosens the mucus. So we want them to use this, right? Okay, so this enhanced airway clearance when used regularly. So this is also used. So our right answers are A, B, D. All of these will help airway clearance and reduce airway obstruction. Let's move on. A 10-year-old with CF returns from school with an increase in cough and green sputum. The child is afebrile, oxygenation is stable, and parents report good appetite. Now, which is the most appropriate medication? Which is the most appropriate immediate nurse action? Notify provider for possible initiation of oral antibiotics and plan outpatient follow-up. B, call EMS for urgent transfer to emergency department. C, start IV antibiotics at home without physician orders. And D, tell parents to ignore it. Green sputum is normal. Pick your answer. Guys, the right answer is A, notify provider for possible initiation of oral antibiotics and plan outpatient follow-up. Let's go through what's happening. A 10-year-old patient with CF returned from school. Now, the 10-year-old returned from school with increased cough, and when the child coughs, there is green sputum coming out when the child coughs, right? But this is the thing, the child is stable. Look, it says in the question, the child is afebrile, that is no fever. Oxygenation is stable, and parents report good appetite. So the appropriate nursing action is for the nurse to call the doctor. Okay, this is the situation. Because you know why? You know why they are initiating oral antibiotics? Because of the green sputum. Because that can suggest or indicate pulmonary infection or exacerbation. When there is green, yellow, rusty color sputum, pulmonary congestion, pulmonary exacerbation, pulmonary infection. And that's why they are initiating the antibiotics, even though the child is stable. And it can be treated outpatient with follow-up, because the antibiotics can be prescribed for the child and the child will take it at home. Because the child is stable, that is why. If the child is not stable, then transfer to the hospital. Because the vitals are stable, the patient have good appetite, and that's why we are treating it outpatient. So that's the right answer. Now B, call EMS for urgent transfer to emergency department. I just said it, the child is stable. There are no signs of respiratory distress like difficulty breathing, using accessory muscle to breathe. There is no hypoxia, no fever, afebrile. So why are we sending to the emergency? So emergency isn't necessary at this point. Now C, start IV antibiotics at home without physician orders. Hold it right there. Hold it right there. Without physician orders. What are you doing? As a nurse, you want to lose your license. What are you doing without an order? You don't initiate any medication without an order. The healthcare provider prescribe the medication. You confirm it. You fax it to the pharmacy. The pharmacy sends the medication. Right? You don't initiate order. Okay. So that alone makes that choice wrong. Okay. Now D, tell parents to ignore it. Green sputum is normal. I just told you when there is color sputum, green, yellow, rusty colored, exacerbation, pulmonary congestion, pulmonary infection. So it is not normal. They shouldn't ignore it. That's wrong teaching. Because if they should ignore it, that can worsen the pulmonary infection. It can lead to lung damage if it's not cared for, intervened to. Pulmonary infection. So we are not asking them to ignore it. Ignoring it risks worsening lung damage and hospitalization. So that's wrong teaching. We are not telling them to ignore. So our right answer is A. Let's move on. Which strategies help reduce cross-infection risk between CF patients in clinic or hospital settings? Select all that apply again. I love select all that apply because it opens your mind to so many things in that question. And once you are able to answer select all and apply, the rest of multiple choices is not difficult anymore. Now let's go through it. Cohorting all CF patients together in the same room for social support. Now, B, strict hand hygiene and contact precautions by staff. C, scheduling CF patients at separate times and physical distancing from each other. And D, use of individual rooms and avoiding patient-to-patient contact. Okay, so let's go through it together. Now, we are talking about strategies to help reduce cross-infection between CF patients to CF patients, cystic fibrosis patients. Okay, now let's go through it together. A, cohorting all CF patients together in the same room for social support. This is absolutely not recommended, even though they all have CF, cystic fibrosis. Now, cystic fibrosis patients can carry different strains of bacteria. There are so many bacteria that can cause lung infection, airway infections in CF patients. So if you are cohorting them together, that will cause increased risk of cross-infection. Okay? One patient's bacteria can become another patient's chronic infection. So if this CF patient have a particular bacteria, maybe even asymptomatic, they do not have lung infection yet. But if they mix with other CF patients and there's cross-infection, that bacteria that didn't hurt these CF patients may lead to chronic lung infection, may lead to serious infection in another CF patients. So that's why we do not want to cohort them together. B, strict hand hygiene and contact precaution by staff. Absolutely, hand hygiene helps to break chains of infection. Hand hygiene is the most effective infection control measure. And when the staff, the nurses, when they are going in, you are putting on you are taking care of the patient with your gloves. Now, hand hygiene before and after patient contact. Okay, now you're putting on your gloves, your gown. There should also be dedicated equipment to that CF patient, like equipment like blood pressure cuff, stethoscope should be used for individual CF patients. So B is true. Strict hand hygiene is true. Now, C, scheduling CF patients at separate times and physical distance for each other. This is also true. Now, CF clinics, they often staggered appointment time so that two CF patients don't come in for appointment at the same time. Okay, and should in case it happens that two CF patients are in the same area, at least 6 feet, 2 meters is encouraged in between two CF patients. Now, D, use of individual rooms and avoiding patient-to-patient contact. Now, standard private room are standard practice for inpatient care for CF patients. CF patients it's recommended should never share a room, and social gathering with other CF patients should be avoided. So our right answers are B, C, D. Okay, now let's move on. Now, which electrolyte abnormality is commonly encountered in infants with CF, especially during hot weather or illness? I've said something like this, so I hope you know. A, hyponatremia due to excessive sweat salt loss. B, hyperkalemia due to renal failure from CF. C, hypercalcemia from vitamin D excess. And D, hypoglycemia from pancreatic islet hyperactivity. Now, guys, pick your answer. The right answer is staring at us. A, hypernatremia due to excessive sweat salt loss. I explained before that CF patients tend to lose a lot of salt through sweating. Especially parents will report, oh, my child's skin tastes salty. That is a diagnosis, and that is why one of the gold standard diagnostic tests for CF is sweat chloride test, because the patient's sweat is analyzed to measure the amount of salt in the sweat. Okay, when the amount of salt in the sweat is less than 30 mmol for infants under 6 months, less than 40 for older children. So if the result is more than 60, then CF. If the sweat content, if the salt in the sweat is more than 60 mmol, then CF is diagnosed. So CF patients lose a lot of salt through sweating in hot weather or even when they're exercising, and that is why, like the previous question we did, is to encourage extra dietary salt. So hyponatremia due to excessive salt loss is right, because they may experience electrolyte imbalance. That's one of the nursing care to monitor their electrolytes, to monitor for risk of hyponatremia. So this is true. Now, B says hyperkalemia due to renal failure from CF. I've told you guys that CF does not directly cause renal failure, but a particular antibiotic they take, which is tobramycin, belongs to a class of antibiotics called the aminoglycosides. So tobramycin is aminoglycosides, and what do they do? And what do you know about them? They are nephrotoxic. They are toxic to the kidneys. So that medication can actually be the one to impair kidney function. But CF does not directly impair kidney function or cause renal failure, kidney failure. Now, C, hypercalcemia from vitamin D excess. Where did you see the excess? Because I told you one of the replacements is fat soluble vitamins like vitamin A, D, E, and K. So they do not have excess vitamin D. CF patients they have insufficient fat soluble vitamins. They do not have excess vitamin D. So where is hypercalcemia coming from? Because of vitamin D excess. That is totally wrong. D, hypoglycemia from pancreatic islet hyperactivity. CF can cause cystic fibrosis related diabetes due to islet cell destruction, okay? But this will lead to hyperglycemia because diabetes hyperglycemia, not hypoglycemia, okay? So this is actually wrong. We will see hyperglycemia, not hypoglycemia. So our right answer, according to the question, the electrolyte abnormality that is common encountered in infants with CF will be hyponatremia A due to excessive sweat salt loss. Now let's move on. Now next question says, a teenager with CF presents with severe sudden abdominal pain, vomiting, and abdominal distension. Did not suspect distal intestinal obstructive syndrome, DIOS. Which findings support this diagnosis of DIOS? A, high-pitched bowel sounds and fecal mass in right lower quadrant on exam or imaging. B, painless bright red rectal bleeding only. C, constant watery diarrhea without abdominal pain. And D, chronic intermittent chest pain unrelated to meals. Now let's go through it. Guys, like I said, we are looking for diagnosis that supports DIOS. No, we are looking for findings that support DIOS diagnosis, distal intestinal obstructive syndrome. Guys, our right answer is A, high-pitched bowel sounds and fecal mass in right lower quadrant on exam or imaging. Let's break it down. DIOS occurs when thick, sticky intestinal content, it could be undigested fats and mucus, block the distal small intestine and proximal colon. Patients will experience severe crampy abdominal pain, abdominal distension, vomiting that may have bile content in it, palpable fecal mass in the right lower quadrant. Okay, so seeing high-pitched bowel sound and fecal mass in right lower quadrants will confirm the diagnosis of DIOS. Okay, now so A is our right answer. Now B, painless bright red rectal bleeding only. Now I've told you guys about only, always. That statement is wrong. But let's look at something. When you see painless bright red rectal bleeding, this will suggest lower GI bleeding. Something like you may see, it may be because of hemorrhoids, anal fissure, or IBD, inflammatory bowel disease. Okay, so in DIOS you will see obstruction and not bleeding. Obstruction because of obstruction of the intestine, and that's why the bowel, let me say, poo didn't get out. It's clogged up and built up in the right lower quadrant, and that's when you palpate it, you will see the mass, fecal mass in the right lower quadrant. Okay, and DIOS is painful. This one says painless, bright red. It is painful, and it involves blockage of the intestine or proximal colon, not bleeding. That is wrong. Now C, constant watery diarrhea without abdominal pain. Just from my explanation, I said there will be abdominal pain, there will be pain, and there will not be diarrhea because the pool is clogged, is blocked, palpable mass in the right lower quadrant. Okay, that is wrong. So that makes it wrong. Now, diarrhea is more of typical of malabsorption and not obstruction. DIOS, obstruction occurs, okay? And also in DIOS, stool is scanty or there's absence of stool because the stool is clogged in the right lower quadrant. That's why you see the palpable fecal mass in the right lower quadrant. So that is wrong. And D, chronic intermittent chest pain and unrelated to meals. You hear unrelated to meals. That should tell you it doesn't have anything to do with gastrointestinal. Now, it could be, see, intermittent chest pain. This may be related to respiratory or cardiac issue and not gastrointestinal, because DIOS is gastrointestinal issue. It involves the colon, the small intestine. So that is wrong. It's unrelated to the pathophysiology of DIOS. So we move on. So our right answer remain A. Guys, this is the very last question. Thanks for watching till the end. Which vaccination recommendation is particularly important for patients with CF? A, routine immunization as per schedule, plus annual influenza vaccine and pneumococcal vaccination as indicated. B, no vaccines are recommended because they increase mucus production. C, live nasal influenza vaccines is preferred for all CF patients. And D, vaccination is optional and provides no benefits for respiratory infection in CF. Pick your answer. Guys, it's very obvious. We're talking about vaccination. We know that vaccines help to prevent or protect against some infections. Okay, so now the right answer is A, routine immunizations as per schedule, plus annual influenza vaccine and pneumococcal vaccination as indicated. Now, CF patients should receive all standard child vaccines, just like any other child, plus extra protection against respiratory infections. And that's why you see here it says plus annual influenza vaccine and pneumococcal vaccination as indicated. Okay, also you know that in CF patients, they are prone to lung infection, so extra vaccination is recommended in CF patients. Annual flu shots, their pneumococcal vaccine and COVID-19 vaccine is recommended. Now B, let's go. B, no vaccines are recommended because they increase mucus production. There is no evidence that vaccines increase mucus production, because keeping vaccine would actually put you at risk of getting infection, and it will also you not taking your vaccine will also worsen CF lung disease. So that is wrong. Now see, live nasal influenza vaccine is preferred for all CF patients. Incorrect. Live attenuated nasal flu vaccine is not recommended in CF patients, especially if the CF patients are immunocompromised. You do not give live vaccines for patients that are immunocompromised. They are on chronic steroids or antibiotics, and if the patient is also hospitalized or ill. So the inactivated injectable flu vaccine is recommended and safer for CF patients. And lastly, vaccination is optional and provides no benefits for respiratory infection in CF. That is a lie, because vaccines are essential in CF patients. They help to reduce risk of infection. CF patients are prone to lung infection, airway infections, so taking their vaccines help to protect them. So immunizations reduce both severity and frequency of infections, of them getting infections. Okay, I hope you have learned a lot in this review. Until the next time, stay healthy.